Welcome to this video where we'll be sharing strengthening exercises to help relieve anterior knee pain. As I've mentioned before, the severity of knee pain can vary from person to person, so there is no one-size-fits-all approach. I'm Dr. Yousefzadeh, specialist in physical therapy, and in this video we'll focus on a plan specifically designed for those dealing with severe anterior knee pain during daily activities such as walking, climbing stairs, driving, standing, and more. Let's start with strengthening the quadriceps. Begin by sitting on the floor or on a table with your legs extended in front of you. Place a foam roller under your knee. If you experience back pain or want to protect your spine, consider leaning back against a wall or another sturdy support for added comfort and stability. Next, gently press your knee down into the foam roller and try to lift your heel off the ground. Hold your heel up for about 6 seconds while your ankle is in a 90 degree of dorsiflexion. Then gently lower it back down and switch to the other knee. Press your knee into the foam roller and try to lift your heel off the ground for about 6 seconds. Then gently lower it back down and repeat the exercise alternately for your both knee. Ensure you're sitting on a firm surface to avoid sinking into it. This exercise should be pain-free both during and after the movement. If you experience pain, try reducing the diameter of the object under the knee. For example, place a rolled towel with a smaller diameter under the knee. The thickness of the rolled towel should be reduced and adjusted until the exercise feels comfortable. Aim for 3 sets of 10 repetitions, and it's best to alternate between both knees. If it's difficult for you, start with fewer repetitions and sets, perhaps 1 or 2 sets of 5 to 8 repetitions. Gradually increase the sets and repetitions as you get stronger. In some cases, the pain and inflammation may be so intense that even with a thinner towel, the movement might still be too painful. If that happens, simply remove the towel and focus on contracting the quadriceps by pressing your knee downward into the ground. The strength of contraction should activate the muscle without causing any pain. This exercise is called quadriceps setting. To perform quadriceps setting effectively, the ideal condition is when the muscle contraction is visibly noticeable, like this. Hold the contraction for about 6 seconds and relax it. Some people may have difficulty fully extending their knee. In this case, fill the space beneath the knee with a towel and gently perform the contraction, making sure it's pain-free. As I explained in part 1 of this video series, releasing and stretching the muscles and tissues around the knee before starting strengthening exercises will make your work more effective. Remember, the goal is to strengthen your muscle without increasing pain. If you feel discomfort at any point, stop and adjust the exercise as needed. To strengthen your hamstrings, start by lying on your back with your knees bent. Lift your hips up and make a bridge position. Press through your heels while lifting toes. Keep the position for 3 seconds and lower your hips down gently. And again, repeat the movement. Try to avoid hyperextending your back. After 3 seconds, lower it back down. Aim for 3 sets of 10 repetitions. It's important to note that some people with lower back or pelvic issues may experience discomfort with this exercise. If that's the case for you, I recommend an alternative hamstring exercise. To perform the alternative exercise for strengthening hamstring, begin by sitting on a chair and flexing your knee against an elastic band. Perform the movement within a pain-free range that works for you. Make sure not to lift your leg during the movement. The resistance of the band should be light enough that you're using only about 50 of your strength to complete the movement. The gluteus medius is another important muscle to strengthen. Start by lying on your side. You can slightly bend your lower leg. Keep your upper leg straight and make sure your ankle, knee, hip, and your shoulder all are in a straight line. Now lift your top heel toward the ceiling, aiming for about a 60-degree angle. Be careful not to let your leg move forward or rotate outward, and keep it moving straight up in a vertical direction and focusing on lifting your heel upward. To protect your lower back, engage your abdominal muscles throughout the movement and perform the exercise for 3 sets of 10 repetitions. If this position feels uncomfortable for you and you experience lower back pain, try an alternative. To perform the alternative exercise, lie on your back with your knees bent and abduct your hips against the elastic band that's placed around your thighs, like this. The band's resistance should be light enough so you're using about 50 to 60% of your strength. Perform the movement for 3 sets of 10 repetitions. The next muscle you need to strengthen is the hip external rotator. This muscle is essential for stabilizing your hip and ensuring proper alignment of the femur. Strong hip external rotators help improve your posture, balance, and overall movement. Start by lying on your side. Keep your knees and ankles aligned, with your knees bent at a 90-degree angle and your hips flexed at about 45 degrees. Now, externally rotate your upper hip while making sure your ankles stay together and your trunk doesn't rotate backward, like this. Since this muscle is typically weaker than others, this exercise can be a bit challenging. It's important to gradually build up to 3 sets of 10 repetitions for each side. If you're just starting, you might want to begin with 2 sets of 4 to 5 repetitions. Another important muscle to strengthen is adductor. Start by lying on your back with your knees bent and place a foam roller between your knees and press your knees together. Hold the contraction for about 6 seconds and then relax. Repeat the exercise for 3 sets of 10 repetitions. The strength of contraction should not be too much to prevent muscle soreness. To strengthen your calf muscles, start by standing up and raising your heels like this. Keep your body upright and ensure your knee remains extended throughout the movement. Avoid pushing your feet too far into plantar flexion. Perform the exercise within a normal range of motion. Aim the exercise for 3 sets of 10 repetitions. To perform the alternative exercise for your calf muscle, lie in a lying sitting position and perform the plantar flexion against an elastic band. The resistance of the band should be light enough so you are using only about 50 to 60% of your strength. Again, aim for 3 sets of 10 repetitions for each side. For strengthening your dorsiflexors, simply change the direction of the resistance. Pull your toes toward yourself against the elastic band. And performing 3 sets of 10 repetitions for each side. The tension of the resistance band should be light enough to use just only about 50 to 60% of your strength. By incorporating these exercises into your routine, you'll improve your knee mobility, reduce pain and stiffness, and support overall knee health. Thank you for your watching. Remember, in my next video, which is part 2, we'll focus on strengthening the muscles that support your knee for long-term relief. Stay tuned and don't forget to like, subscribe, and hit the bell icon to get notified.